Hello everyone, welcome to Pediatrics by Dr. Anand. And in this segment, we're going to talk about a very important topic that is HIE. HIE is nothing but hypoxic ischemic encephalopathy, HIE. Okay, this is a very beautiful session. This session will be exactly for 30 to 35 minutes. I hope my voice is audible to everyone. If my voice is audible, please put a message in the comment section. This is the Unacademy platform. Hello, everyone. A wonderful welcome to all our amazing students. And I am Dr. Anand, MD Pediatrics, and I am your best teaching faculty for pediatrics. So let's start. For the newcomers, we have something known as in Academy, we have something known as Plus subscription and something known as Iconic subscription. In the Plus subscription of the Unacademy, if you are a newcomer, then remember, then you get to access all my beautiful live and recorded sessions, and also at the same time you get to see and listen and learn from the best educators all over the India. And also we have beautiful live tests and quizzes which will be amazingly helpful for you. You can watch me on your iOS, on your Android phones, and also on your laptop. Okay, and also we have this n number of multiple amazing MCQs which you can do. This is the Plus subscription. Hello my dear Bheem, Hamid. Hello Hamid, Sandhu, हुमान, लोगा, बालाजी, क्या चल रहा है? व्हाट्सअप, क्या किया शाम को सबने? व्हाट डिड यू डू? एनीवन वेंट टू जिम? एनीवन डिड एनीथिंग प्रोडक्टिव? बस पढ़ते ही रह गए पूरा टाइम, क्या किया? And also students who are a newcomer, we have something known as Iconic subscription. In that you get the Unacademy whole package, as well as you get the prep ladder package also, all the clinical questions, videos, everything possible, revision, rapid revision notes, everything. So that's Iconic subscription. Okay, hello Akanksha, hello Subhashmita. And also for the newcomers, if you are watching me for the first time, we have this Unacademy. In the Unacademy app also, we have something known as special class, where we can ask MCQs to each other, we can ask doubts. You will never miss my class because all the lectures are recorded. You get the PDF of all the whatever I write, the proper notes, you get the PDF out of it. And it's an interactive session always. And also a beautiful congratulations to our amazing NEET PG 2021 candidates. And our target is that in the March 12, 2022, the names which I'm mentioning, Hamid, Sandhu, Human, Balaji, Akanksha, and Subhashmita, nice name, Subhashmita Sahu, very classy name. So all those people names and photos will be there, guys, on 12th March 2022. And beautifully, we have this amazing FMG 2022 batch and NEET PG 2022 batch, which is almost going full. Everyone is participating. If you're a newcomer, you must participate. And also, you can boost your medical PG preparation. If you buy the whole 6 months plan, you get 1 month complimentary. If you buy a 12 months plan, you get 2 months complimentary. And if you buy a 24 months plan, you get 4 months complimentary of this our app. And people, like for students, for financial benefits, we have this code also. Like if you are a newcomer, you can use this code Dr. Anand. You'll get some discount from the whole package. It will be easy for you because we can understand the students, they always have so many things to do, financially. So this is our coupon code which will be helpful for you if you are taking the app. Let's start the whole journey. Today's topic of choice is neonatology. The subtopic is HIE. HIE. And before starting any beautiful topic, today's topic is perinatal asphyxia or birth asphyxia, or nothing but HIE. Okay, I'll be telling you depth of this in detail. Don't worry about it. It'll be a very happy session. Tension nahi lena, खुशी खुशी दिल से पढ़ना है, ठीक है? So before starting any beautiful quote, before starting any beautiful lecture, we have this beautiful quote. And today's quote is, mindset is what which separates the best from the rest. Mindset is what which separates the best from the rest. If you have a vision, if you have a focus, if you have a mindset that this is my plan for next 3 months, I'm going to study, I'm going to do every subject possible, I'll do a lot of MCQs, I will join a lot of live classes, I will ask doubts wherever possible, and I will improve my memory and knowledge. And I will help my friends at the same time also in clearing the exam. If you have a mindset, if you have a vision, if you have a focus. So mindset is what which separates the best from the rest. पढ़ाई तो हर कोई करता है, everyone studies, like this much of students, they study, everyone studies, but only a mouthful of students, a handful of students clear the exam. Why only this much clear? Every year lakhs, so many students apply, because mindset is what which separates the best from the rest. That is why, that is why I always tell everyone, Sandhu, Subhashmita, Kanksha, Balaji, our Hamid, you need to have a focus, bro. You need to have a mindset, you need to have a focus, you need to have a target, you need to have a schedule. A plan without a focus is of no use. It's like, you're wasting your time. You need to have a plan, you need to have a focus, you need to have a vision. नहीं, हम सब पढ़ रहे हैं, देखते हैं हो जाएगा, आई एम जस्ट ट्राइंग सर, होगा तो ठीक, वरना इट्स ओके. नो, डोंट डू ऑल दैट. Have a vision. Sir, I will clear. Sir, I have a plan. 3 months left. Sir, I will study everything. However, how much ever possible, I'll do it. And whatever I'll study with understanding, not cramming. I'll understand the concept. Okay? Are you understanding? Sandhu, Subhashmita, Balaji, घुस रहा है? Is it entering in the brains? Whatever I'm telling you, it is going above the brains. Okay? So mindset is what which separates the best from the rest. Okay? So start with this beautiful positive quote. Let's start the whole journey. Yes, the topic is perinatal asphyxia or birth asphyxia or HIE. All three are same meanings. Hello, Human. Hello, Combat. Good evening, sir. कैसे हैं आप? Okay, let's start. So, देखो, it's a very easy topic. Okay, just relax your brains, relax yourself, and just watch me like you're watching a Netflix series. Just look at me like that. Okay, just listen to me. In perinatal asphyxia or birth asphyxia or something known as HIE, which is nothing but hypoxic ischemic encephalopathy, है ना? This much are you able to understand? These three are same meanings. Okay, perinatal asphyxia, birth asphyxia or HIE are the same meanings. Okay, what is the layman thing which I should understand? The thing I should understand is baby did not cry immediately after birth. Baby did not cry immediately after birth. I told you in the NRP guidelines, yes or no, okay, it's better to give no baby. It's better to give no baby than giving a bad baby. My HOD always used to say, it's better to give no baby than giving a bad baby. Bad baby matlab, normally a baby should cry immediately after birth. If the baby did not cry immediately after birth, for example, like, let me ask you, okay, Hamid, can you tell me one example of baby not cry immediately after birth? Like one cause, कि सर ऐसा होगा तो baby will not cry immediately after birth. Can anyone mention only one cause that if dash will happen, baby may not cry immediately after birth? Any random guesses? Sandhu, सुभाषमिता, what is that cause? Could you tell me one cause जिसमें बच्चा देरी से रो सकता है, जिसमें बच्चा थोड़ा देरी से वो हो सकता है? या ठीक है, संधू से सर आपके कोर्स भी याद हो रहे हैं, बहुत अच्छी बात है भैया, याद कर लो. मेरा एक जूनियर था, आई रिमेंबर लास्ट ईयर नीट पीजी, उसमें he had my notes, like whatever I used to teach. With the notes, he had all the quotations which I used to teach before and after the lecture. So once he cleared the exam, he got a very good rank, and he came to me, he showed me his notebook, and he had, my goodness, every single positive quote which I was having. He had a list of that. He's like, sir, मैं इसी वजह से पास हुआ हूँ, पता नहीं पढ़ा, लेकिन इतना पॉजिटिविटी कर करके अपने आप ही मैं क्लियर हो गया रैंक मेरा. So this is a good thing. Okay, हाँ जी. Yes, very good. Yeah, very good. Who said? Sandhu is right. Sir, the baby was having cord around the neck. When the baby was born, there was umbilical cord, 2 loops of cord around the neck? नाम सुना है आपने? Yes or no? So the baby did not cry because there were 2 to 3 loops of umbilical cord around the neck. Sir बच्चे ने potty कर दी sir. So the baby passed meconium sir inside the mummy's tummy. Nothing but meconium aspiration syndrome. So sir, because baby passed meconium, baby swallowed meconium sir. That is why baby did not cry sir. Sir, baby is extremely preterm sir. Sir, extremely preterm baby sir. What is extremely preterm? Less than 28 weeker. Less than 37 weeker is a preterm, but less than 28 weeker is extremely preterm. Every single word which I'm telling is a NEET PG question, okay? So don't take it for granted. Every single word matters, whatever I'm saying, okay? It should go in directly inside your sulci and gyri, okay? So yes, sir, baby was extremely preterm, sir. Sir, the lungs were not formed properly, sir. Surfactant was not formed, sir. So baby, that's why could not breathe and did not cry immediately after birth. So are you getting it? Yeah, very good. So yeah, combat healer is already answering, very good. तो किसी भी कारणवश because of any reason, meconium aspiration syndrome, respiratory distress syndrome, 2 loops around the neck, maternal hypertension, anything, if the baby has not cried immediately after birth, because once the baby cry, okay, my cry is very bad, okay, it's very pathetic, but I'm giving an example, okay? So once the baby cries, so he takes a breath, okay? For crying, I need to take a breath. So I need to take a breath, right? So once I take a breath while crying, my lungs are inflating and deflating. So oxygen is going inside my brain. Yeah, hai na? Yes or no? It's a very simple, like a 7th class I'm teaching you like that, okay? If the baby has not cried, so baby is fully like hypotonic, so lungs inflate, deflate will not happen, and oxygen will not reach into the brain, है ना? That will lead to, of course, that will lead to something known as hypoxia. So that will lead to hypoxia, and that hypoxia will lead to brain damage, ischemia, and that will lead to encephalopathy. Hypoxic ischemic encephalopathy. Okay, this is what we are able to understand in this. Okay. So any reason baby has not cried immediately after birth, sir, baby can land up into some entity known as HIE. It is also known as, sir, birth asphyxia, or sir, it is also known as perinatal asphyxia. Perinatal means like 22 weeks period of gestation to 7 days after birth. You might be knowing that word, perinatal. So during in the mummy's tummy something happened, perinatal, and once the baby was out, he was having asphyxia. Okay, so this is the first point. These three are same meanings, and baby did not cry is our basic dictum. वहां से कहानी, पूरी कहानी, the whole story will start from baby did not cry. Baby did not cry. Okay. So this topic will be divided into definition, pathophysiology, staging, diagnosis, and treatment. Okay. So definition, the first definition of HIE, WHO says, it's very easy definition: inability to sustain or initiate breathing. That is known as HIE. Do you agree with me? Yes or no, Hamid? Inability to sustain breathing और initiate breathing. या तो breathing शुरू ही नहीं हुई, अगर हुई तो sustain नहीं रह पाई. Inability to initiate breathing or sustain breathing. Are you with me? Yes or no, everyone? Am I making sense to you? I hope there's nothing to cram in this. It's just understanding. Okay, baby did not cry. So WHO defines HIE with inability to initiate breathing or inability to sustain the breathing. That is the first definition by WHO of HIE. Second definition is also on the basis of Apgar score. In our continuation of the first, like tomorrow, day after tomorrow, I'll be taking classes. So Apgar score is one of the segment we're gonna cover day after tomorrow. I'll share the whole list of the December topics with you. So Apgar score, just remember right now that HIE is also defined on the basis of Apgar score. Please remember, normal Apgar score is more than 7. Apgar score is a scoring system for the clinical evaluation, clinical assessment of the baby. Apgar score is a scoring system for the clinical. बच्चा clinically कैसा है, ठीक है, बुरा है कि बहुत बुरा है? How is the baby clinically? Good, bad, or very bad? If the baby is clinically good, clinical assessment is good, then Apgar score will be more than 7. More than 7. And if the Apgar score is 4 to 7, that means moderate perinatal asphyxia or birth asphyxia. And if the Apgar is less than 3, then that is known as severe perinatal asphyxia or birth asphyxia. Are you with me? Star mark and star mark. This was a NEET PG question, last to last year NEET PG question. A newborn baby with Apgar score, a newborn baby with Apgar score 5. So what do you think where the baby is land up into? Apgar score 5, is it normal? Is it moderate birth asphyxia or is it severe birth asphyxia? The answer was it is moderate birth asphyxia. If someone who is giving the exam for the second or third time, he must be knowing that this was a question which had come in the NEET PG exam. So I'll repeat again. What are we studying? Neonatology. Which topic? HIE, or same known as birth asphyxia or perinatal asphyxia. It is defined, WHO defined birth asphyxia as inability to initiate breathing or sustain breathing. That is WHO defines. HIE is also defined on the basis of Apgar score, where the Apgar score, sir, normal should be more than 7 is normal, sir. If it is between 4 to 7, that is moderate perinatal asphyxia or birth asphyxia, and less than 3 if it is there at first minute. Apgar score is done at first minute, 5th minute and 10th minute. Always remember, Apgar score is done at 3 times: first minute, 5th minute and 10th minute. If the first minute Apgar score is less than 3, that is known as severe perinatal asphyxia or birth asphyxia. इतना समझ में आया? Did everyone understood this much? Yes or yes, yes? What do you think? Because there is no. Balaji, Human, Isha, Vanilla. We have new names also. Vanilla. Okay. Combat. समझ में आ गई कहानी इतनी? आगे बढ़ें? Can we continue? Okay. Great. Okay, fine. So Apgar score is also the HIE is also defined by AP, American Academy of Pediatrics. There are see now there are three definitions. Okay, three definition of the HIE. One was WHO definition, one was based on Apgar score, and one is based by told by AP. What is AP? American Academy of Pediatrics. American Academy of Pediatrics. So there are three definitions. Again, at the same time, my dear friends, I don't want you to cram the definitions, but you should know the concept. Okay, baby did not cry. Baby did not cry. I can define it according to Apgar score also, and that's already a NEET PG question. I can also define by WHO that initiate to like difficult inability to initiate breathing or sustain breathing. And last but not the least, this HIE is also defined on the basis of ABG. ABG. Okay, what is ABG? Arterial blood gas analysis. Arterial blood gas analysis. We'll do a clinical classes also. I'll teach you how to read an ABG also. In that ABG, of course, right, you see the pH, you see the CO2, and you see the bicarb. Three things is what you see in the ABG, and then you get to know whether it is metabolic acidosis, respiratory acidosis, and all that. So ABG, yes, yes. So on the basis of APG, remember one thing you should need to know, that on the HIE is defined according to AP based on ABG, and what ABG? pH less than 7. Umbilical cord pH less than 7. You know, right? Umbilical cord is there, 2 artery and 1 vein. So if I take a arterial blood gas analysis of this umbilical cord, and if the pH is less than 7, then means bacha is very much bad. Baby is into birth asphyxia. What is the normal pH, Hamid? Normal pH कितना होता है? Any random guesses? Anyone? What is the normal pH? Vanilla, Shamir, Sandhu, Isha, Akanksha. Yes, Shamir, you got my ID. So this one, yeah. What is the normal pH? Any random guesses? 7.35 to 7.45 is the normal pH of my body. Anything less than 7.35 will be known as acidosis, and anything more than 7.45 will be known as alkalosis. Have you heard these terms? क्या आपने इन चीज़ों के बारे में नाम सुना है? These all things you might have done in your internship, in your casualty postings, in your medicines, surgical ICU posting, where when the patient is very sick, adult or pediatric, you take the arterial blood gas analysis. You take a heparinized tuberculin syringe and you take the sample. Insulin syringe, you can say, not tuberculin but insulin syringe. ठीक है, done. Yes, so that finishes the first definition of Apgar of the HIE on the basis of what you call the WHO, on the basis of Apgar, on the basis of American Academy of Pediatrics. Let's move further. Okay, yes. आगे बढ़ते हैं, ठीक है? मज़ा आ रहा है? Are you guys enjoying? ठीक है? Or you want to talk about life and leave this topic? No, I think we should talk about this first and then we should talk about life. Okay. Huh. Okay. So, HIE. Now we need to know the pathophysiology. What happens during labor? Like, which topic are we discussing? HIE. So our whole story revolves around baby did not cry, baby did not cry, baby did not cry. Why baby did not cry? Why? What was the reason baby did not cry? So during labor, there is decreased blood flow to placenta. During labor, during labor, there is decreased blood flow to placenta. In HIE, during labor, there is, see now listen carefully. Whatever I'm teaching, understand, okay? If you have doubt, ask me. Sir, why there is decreased blood flow to placenta? Hamid is always asking doubts. And Anshu, one fellow, that also he always asks doubts to me. So that's good. So during labor, during labor, there is a decreased blood flow to placenta. Why there is decreased blood flow to placenta? The reason for decreased blood flow are either could be because of cord compression, either could be because of uterine contraction, or could be because of maternal dehydration. Now listen very carefully, very carefully. It's very simple, okay? Try to have a logic. What are we studying? HIE. Baby did not cry. Hypoxia. I am saying in HIE, how the whole journey starts. During labor, there is decrease blood flow to placenta because of number one, cord compression. Yes or no? Naturally, if umbilical cord, if I compress, how the blood will go to the baby? Yes or no? So when the umbilical cord will compress, the placenta will compress, right? So during labor, just have a hypothetical image in your mind. During labor, there is decreased blood flow to the placenta. Could be because of cord compression, could be because of uterine contraction. Either when the uterine contractions are there, then also the umbilical cord kind of squeezes out, like kind of tightens up, so there is decreased blood flow to the placenta. And also maternal dehydration. Just remember the logic. Because of these three conditions, there is decreased blood flow to placenta. Okay. Now, when there is decreased blood flow to the placenta, what happens? So, means decreased blood flow. See, decreased blood flow to the placenta. This is the placenta. Decreased blood flow to the placenta, matlab decreased blood flow to the umbilical cord, है ना? And decreased blood flow to the baby. Yes or no? Do you agree with me? When there is decreased blood flow to the placenta because of either uterine contractions, any cord compressions, or even in general also maternal dehydration, because any reason, any hypoxia, any problem, whenever there is decreased blood flow to the placenta, there will be decreased blood in the going through the umbilical cord. When there is decreased blood going to the umbilical cord, will be decreased blood receiving to the baby, है ना? And what are we studying? We are studying that a baby's brain will be damaged. HIE we are studying, no hypoxia. ठीक है? Are you getting me? है ना? समझ में आ रहा है? So whenever there is brief hypoxia because of any reasons, maternal dehydration or whatever, whenever there is a brief hypoxia in the baby's body, there is diving reflex. There's something very beautiful known as diving reflex. Diving, gotakhori. Diving reflex matlab whenever there is a hypoxia or whenever there is insult in our body, in baby's body, any body, the blood supply to the vital organs will increase. Like the blood supply will go to the vital organs, and blood supply will be compromised or decreased to the non-vital organs. This is the defense mechanism of the baby. Are you understanding? Of anyone. If I am also losing blood, if I got a road traffic accident tomorrow, so if I'm bleeding out, so compensate. Diving reflex always takes place. That main is my brain. Okay, if my brain becomes dead, then my whole body is dead. That time body's focus is not kidney or liver. My body's focus will be brain and heart, right? So blood supply to the vitals organs will increase. Yes, very good, Shamir, very good Tandu, Isha. So सांस ले लूं मैं एक सेकंड. Yeah. So in whenever there is brief hypoxia, there will be normally there is diving reflex where the blood supply to the vital organs will go, whereas blood supply to the non-vital organs, for example, my intestine or anything like that, there will be compromised blood flow. It's a compensated defense mechanism of the body normally. But now in HIE, in HIE, when there is a brief hypoxia, diving reflex does not occur. This is the first very important point you need to know. Why the baby did not cry, baby did not cry. So, in simple words, you should know when the baby did not cry or whenever there is hypoxia, normally there is diving reflex. But in HIE, in such a brief hypoxia, because maternal dehydration or cord compression, it's just a very brief thing, right? So whenever in HIE there is a brief hypoxia, diving reflex does not occur. उससे क्या होगा? Naturally, so there will be issues, there will be brain damage, right? Because blood supply to the vital organs such as brain will not go, will be compromised now. That will lead to injury to the subcortical area and the brain stem, and that leads to HIE. Okay, that leads to injury to the subcortical area and brainstem, and that leads to HIE. Okay, I hope you're able to understand. Did you understand this much? Yes or no? It's a pretty further topic. First, try to get this concept simple, clear, and once you get the whole topic, your other minor doubts will be over. Okay, Sahil Gandhi says, why hypoxia causes acidosis? Dear, whenever there is hypoxia, means decrease oxygen, right, in my body. So two types of metabolism takes place. One is aerobic metabolism and one is anaerobic metabolism. So whenever there is hypoxia in my body, means decrease oxygen, my aerobic metabolism is like almost exhausting out. So that way my anaerobic metabolism will start taking place. And in anaerobic metabolism, whenever the anaerobic metabolism takes place, lactic acid or lactic acidosis or lactic acid generates. That leads to more and more lactic acid, means acidosis, and that's lead to metabolic acidosis, or it's a component of shock. That's why. Okay, so let's move further. Okay. Now the next pathophysiology. One part diving reflex wala segment is over. Now next pathophysiology. Again, whenever there is hypoxia, because what are we studying? Hypoxic ischemic encephalopathy. The first thing has to be hypoxia. The first thing has to be insult. Insult होगा तो कहानी चालू होगी ना आगे. So whenever there is a hypoxia, हाँ संधु, कैन यू एक्सप्लेन द मैकेनिज्म ऑफ HIE? यस माय डियर संधु, आगे है बहुत सारा मैकेनिज्म है, वो सब समझ में आ जाएगा आगे, बस सुनते रहो शांति से, भगवान का नाम लेके सुनते रहो, ठीक है? चलो थक गया है। Okay, so in the pathophysiology of the HIE, whenever there is hypoxia, what happens? There is ischemia, है ना? Whenever there is hypoxia, there is ischemia, right? Because whenever the oxygen is come, my tissue will start getting ischemic, right? Because oxygen is not there. So that leads to primary energy failure. See, we have two injuries, okay? Primary energy failure and secondary energy failure. Whenever there is hypoxia, first listen to me, everyone. Just put notes, whatever I'm trying to tell you, let's just finish the whole thing. Because if I start putting the doubts now, then ये चैन ब्रेक हो जाएगा. एक बार पूरा सुन लो, कहीं ना कहीं ऑलमोस्ट सारे डाउट्स एंड तक अपने आप ही खत्म हो जाएंगे. फर्स्ट लिसन फुल्ली, बाय द एंड all the doubts will be cleared, okay? And if not, I'm there to answer. Okay, the further pathophysiology, whenever there is hypoxia, baby did not cry, baby did not cry, baby did not do like this. So he didn't cry, he didn't take a breath. So hypoxia. Whenever there is hypoxia, there will be ischemia. That ischemia lead to primary energy failure. Same thing only, whenever there is a primary energy failure, then anaerobic metabolism, we have aerobic and anaerobic. So aerobic to khatam ho gaya, exhaust ho gaya, primary energy is failed now. So anaerobic metabolism will start taking place, and in that one I told you, in anaerobic metabolism there is increased amount of lactate, glutamate, all those, and various free radicals are generated, okay, in anaerobic metabolism. Again, why there is anaerobic metabolism, sir? Because aerobic metabolism is over. No, there is primary energy failure. Why there is primary energy failure? Because hypoxia, baby did not cry. When there is no oxygen from the body, then how my metabolism will take place? The anaerobic metabolism will start. That lead to increased amount of lactate, glutamate, and that leads to nothing but increased production of free radicals also. Now listen very carefully. There is increased production of free radicals generation in an area surrounding the necrotic area. Imagine this part of the body is already having ischemia, and also there is surrounding increased production of the free radicals. First listen to me the full lecture, try to have a hypothetical component in your mind, and then we can have the doubts. What happens? I'll repeat again. Whenever there is hypoxia, baby did not cry. Baby did not cry. So baby did not cry. He didn't take a breath. He didn't take a breath. So he got hypoxia. Whenever there is decreased oxygen, that tissue, that brain tissue will go into necrosis, or I would say ischemia. Ischemia will happen. And that leads to primary energy failure, and anaerobic metabolism will take place. That leads to anaerobic metabolism in lactic acid, lactate, glutamate, free radicals. All these people get generated, which is very harmful, to my body, है ना? So that leads to increased production of free radicals generation in an area surrounding the necrotic area. So this area is the necrotic area, and again, that is one thing which is bad. And second, this one is nothing but free radicals generation. So outside we have free radicals and inside we have necrotic area. This is known as penumbra. This is known as penumbra. And this is the secondary injury. Please remember, I told you this is primary injury and secondary injury. In primary energy failure, in primary injury, there is just hypoxia leading to ischemia. So aerobic metabolism gone, that is primary energy failure. Later, when free radicals are formed outside and necrotic tissue is inside, that whole thing is known as penumbra. And this is secondary energy failure. Okay, this primary energy failure and there is secondary energy failure. Try to grasp in your mind as much as possible. Okay, there is primary energy failure and secondary energy failure. In the primary energy failure, there was simple hypoxia. बच्चा नहीं रोया, hypoxia हुआ, ischemia हुआ तो damage हो गया. That is primary energy failure. After the damage, then anaerobic metabolism will take place. Lactate, glutamate, and free radicals will come, and free radical will come out, and necrotic area was inside. Now, this whole double bad it is. That is known as penumbra, and this is the secondary injury. After that, now this is very important, okay? The penumbra undergoes apoptosis even after hypoxia insult is over. Nothing, in just layman word, this is the secondary injury which is going to happen and which is very, very bad. This is very, very bad. Now, one thing you have to understand, the time gap between the two phases. Which phases? Primary, now this is very important point, okay? Primary injury and secondary injury, right? There was primary injury when hypoxia was there and ischemia happened and anaerobic metabolism took place. One injury happened, that is primary injury. And when penumbra is formed, that is secondary injury. So the time gap between primary injury and secondary injury could be 6 to 24 hours. Please remember, this is a very crucial time where I can do a reversible. The damage is reversible. You know, हम कहते हैं बच्चा पैदा होके अगर नहीं रोया, अगर बहुत देरी हो गई, if the baby did not cry and baby has crossed a lot of time, then the baby will go into irreversible damage. The baby will go into irreversible brain damage. This window period of primary and secondary energy failure, that window period, now at this moment there is reversible damage. I can reverse the injury, but once I cross too much, there will be, irreversible brain damage. So I'll repeat again, we have primary energy failure and secondary energy failure, and the time gap between the two phases could be 6 to 24 hours, and that provide a window to institute specific therapeutic intervention. Nothing, in simple English words, you can prevent the damage to the baby. You can help the baby. If you got that window period, if you understood the window period between primary and secondary injury, so that area you can do a reversible. The damage will be reversible. That's what it's trying to say. Okay, that's it. And yeah, coming to the next part, did you understand this much, everyone? Should I repeat the whole thing, or you have almost got it? Tell me this again. See, this is the little conceptual topic. If you're reading for the first time, I can understand you will not get everything एकदम से नहीं आने वाला. It takes time to understand. अच्छा ऐसा होता है, अच्छा फिर ऐसे होता है करके ऐसे. So did you understand some part of it? Should I repeat or should I continue? Please let me know. Vanilla, Isha, है ना? Very good. अंशु, हाँ जी, क्या हाल है अंशु पांडे? ठीक हो? संधु, साहिल, शिमीर एंड आकांक्षा मिश्रा. ठीक है, आगे बढ़ते हैं. नाउ ओके, व्हाट इज द नेम ऑफ द स्टेजिंग ऑफ HIE? एनीवन? ये तो मैंने पढ़ा रखा है. हामिद कहाँ है? हामिद, What is the name of the staging of HIE? बेटा तुमने आंसर ना किया ना, देखो तुम्हारे मैंने क्या हाल करना है फिर. What is the name of the staging of HIE? Do you know some name? Have we studied in our previous classes? This is neonatology part 21, 22. So anyone? Yes, Sahil is right. We have Sarnet and Sarnet. There are three staging of HIE, three names you should know. One is Sarnet and Sarnet, one is Levine staging, and one is Thompson score. Thompson score. These three words you should know. These three are the different stages used in various hospitals. In OPGHI, they have mentioned only about Levine staging. It's a very sweet, small staging. In the Nelson and Cloharty, the other big books of peds, they have given a very huge staging known as Sarnet and Sarnet. And for the prognosis of the child, if the baby is having bad prognosis or poor prognosis, we use something known as Thompson score. Not Thompson staging, Thompson score. At least for PG purpose, for NEET PG exam, at least these three names you must be knowing, and little points of about them, very little. I'll tell you the MCQs and it will be easy. Number one, this is the Sarnet and Sarnet. This is the Sarnet and Sarnet staging, okay, of HIE. What all, sir? क्या क्या मुझे पता होना? Sir, I can't cram the whole staging. It's too big, sir. Sir, please tell me mota mota, like what all should I know and what all I should not know. Sarnet and Sarnet staging. Point number one, you need to know how many stages are there in Sarnet and Sarnet. The answer is there are three stages. Stage 1, stage 2, stage 3. इतना समझ में आ गया? Sarnet and Sarnet. Yeah. Okay. At any given time, it's more in vain. Okay, cool. क्या कहते हैं? Can we continue? So, number one, Sarnet and Sarnet staging. Sir, tell me 5 points which I should remember for PG exam. बस उतना बता दो मेरे को जो exam के लिए important है. Number one, they will ask you how many stages are there. There are 3 stages. Stage 1, Stage 2, Stage 3. Okay. Stage 1, Stage 2, Stage 3, which is there. Stage 3 is very bad. Stage 3 is bad, like mild, moderate, severe. Bad, very bad, like that it is. Okay. Now they are going to ask you very important things. Pupil. This was the first question NEET PG they had asked. What are the pupillary findings? What are the pupillary findings which we see in HIE? Please remember, in stage 1, there is mydriasis, dilatation of pupil. In stage 2, there is meiosis, means pinpoint or a constriction of pupil, and in stage 3 there is unequal pupils. That is the first NEET PG question which you should understand, that what are the pupillary findings in HIE. Sir, stage 1 में mydriasis होगा, stage 2 में meiosis होगा, and stage 3 will be unequal pupil. Also, very important, Muru reflex. Yes or no? Have we studied about Muru reflex? Hamid, Akanksha, Anshu, Vanilla, ईशा पढ़ा है मुरूस? कब होता है मुरू डिसअपियर? When does Muru reflex disappear? Anyone? When does Muru reflex disappear? What do you think? Anyone? हाँ जी. Very good, very good. That's right, Isha. So yes, so Muru reflex disappears by 6 months. The best answer is 6 months. Okay, not 5 months, not 7 months. If the options are 5, 6, 7, 8, 6. Muru reflex disappear by 6 months. Hamid, don't say 5, it's 6. Vanilla, don't say 4, it is 6. Balaji, don't say 5 to 6, it is only 6, because there are options 5 months, 6 months, 7 months, 8 months. The book says 6 months being the best answer. 6 months being the best answer. Okay. Naman, very good. Naman Goyal, very, very good. चलो आगे बढ़ते हैं. Please remember, I told you that exaggerated Muru is seen in stage 1, whereas absent Muru is seen in stage 3. Yes or no? Did we study that? Yes or no? Anyone? We are doing NEET PG questions, okay, back to back. It's very good. Okay. Yeah. So I'll repeat again. They had asked about the pupils. You should know mydriasis in stage 1, meiosis in stage 2, unequal in stage 3. Then they ask about Muru reflex. Stage 1 HIE will have an exaggerated Muru, and stage 3 HIE will have an absent Muru. And also they had asked a NEET PG question on seizures. Do you see seizures in stage 1 HIE? The answer is no. You see seizures in stage 2 or stage 3, but you do not see seizures in stage 1 HIE. In our nursery also, once the baby comes of cause of birth asphyxia, did not cry, very badly meconium stained and all that, we admit the baby. But once the baby starts scissoring, we diagnose at stage 2 HIE. Before that, it is stage 1 HIE based on Apgar, based on WHO, based on ABG findings. But if the baby is scissoring, you will say stage 2 HIE. ठीक है? Did you understand this much? These are very beautiful, wonderful questions which were kind of doing it. समझ में आ रहा है या दिमाग के ऊपर से जा रहा है? ईशा, हामिद, संधू, बालाजी, वनीला, नमन. Today we have so many students. Okay, great. आगे बढ़ते हैं. Then this part is over. Yeah. Then we have Levine staging. Levine staging. One was Sarnet and Sarnet. This is Levine staging of HIE. It's the Levine staging is nothing but CTSS. The 4 points of the Levine staging are just the name you should know, dear. CTSS मतलब consciousness, tone, seizures and suck. Consciousness, tone, seizure and suck. These are the 4 important points of Levine stage of HIE. समझ में आ रहा है my dear? This is a very beautiful and very important topic. अगर इतना समझ में आ गया, मतलब you can cover difficult questions also, you can cover if comes in NEET PG exam. So Levine staging, sir, that is also for HIE. It is divided into mild, moderate and severe. Please remember, Sarnet and Sarnet was stage 1, stage 2 and stage 3, whereas Levine is mild, moderate and severe. The mnemonic is CTSS, consciousness, tone, seizure and suck. Consciousness, tone, seizure and suck. And always remember, I told you that seizure is seen in stage 2, or you can say in the moderate staging of the HIE. Well, it's almost like stage 1, stage 2, stage 3 only, no? But remember, in the stage 2 or the moderate, you will see the seizure. That is very important. Okay, done. Let's continue. Yeah, and then we have Thompson's score. I told you Thompson's score is another that for the prognosis of the baby, we use Thompson's score. Just this much name you should know. Okay. Yeah, seizures always tells about stage 2 HIE. This we have already done. And yeah, this is a very good question. This and the next NEET PG question is, which, if a term baby has got HIE, if a term baby did not cry immediately after birth, which area of the brain is affected? If a preterm baby did not cry immediately after birth, which part of the area brain is affected? Okay, Bheem, are you understanding? Naman, my dear, समझ में आ रहा है ना? So these two are the another NEET PG questions. Please remember, if there's a term baby with HIE, the brain of the area affected is parasagittal area. Parasagittal. वो कहाँ होता है sir? Sir, where is it? This one, but I'll show you. Can we see that? Today only morning I was just randomly making a diagram. This is my skull. This part, this is known as parasagittal area. This is known as parasagittal area. If a term baby did not cry immediately, the NEET PG question is, which is the commonest area affected? It is parasagittal area. And if a preterm baby did not cry, then the area affected is this one, that is the periventricular area. Periventricular area. Did you understand? Yes or no? These two PG questions over. We finished them. Almost like in 15 questions we have covered. Okay, chalo, done. Next. Yeah. So what are the, okay, now it's almost ending of the topic. So both sides of sagittal suture. Yeah, dear. Yes, bro. Both side only. Parasagittal, but yeah, both sides. You can say that. Okay, effects of asphyxia on CNS. What do you think, anyone? If baby did not cry, what are the CNS effects you can have? What do you think? हामिद, संधू, ईशा, अंशु, क्या क्या CNS में क्या क्या बेबी आपको करा सकता है? Number 1, can the baby throw seizures? Can the baby throw hypotonia or hypertonia? Can the baby show any decreased reflexes? Altered sensorium? Yes or no? These all things baby will show you. Like, yeah, very good. Seizures, unconsciousness, quadriplegia, paraplegia, anything you say, everything you say, CNS, पूरा CNS उड़ जाएगा, affect हो जाएगा. And one of the thing is HIE. Of course, HIE is what you need to understand. Okay. In the rest, just remember one thing. In the respiratory system, there will be pulmonary hypertension. always the lungs are involved in that. In HIE, that will lead to pulmonary hypertension. Just write this point in your notebooks. Respiratory system, one of the important point will be pulmonary hypertension. And in skin, because there is so much of hypoxia, because there is decreased oxygen, because there is damage, ischemia, right? So there will be necrosis. Which necrosis? Subcutaneous fat necrosis. Subcutaneous fat necrosis. This, see, why I'm stressing on these points. Star mark, it has been a question. Star mark, it has been a question. Star mark, it has been a question. So in the skin, just remember the patient will have subcutaneous fat necrosis because of the ischemia. In respiratory system, there will be pulmonary hemorrhage, and in CNS there will be HIE. Okay, let's finish the whole topic. Remember, there is hypoxia or ischemia. In HIE, everything will be down. Down matlab there will be hypoglycemia, there will be hypothermia. If I ask, what are the features or what all HIE can happen? Yes, hypoglycemia, hypothermia, hyponatremia, hypokalemia, and hypocalcemia. मतलब calcium will be low, everything big, hypoxia, no oxygen, no metabolism is falling down, so everything will be down. Baby's RBS will be low, hypoglycemia. Baby will be thanda, hypothermia, less than 36.5. Baby's sodium will be less than 135, like 135 to 150 milliequivalents per liter is normal sodium, right? There will be hyponatremia, and less than 3.5. Hypokalemia, potassium, normal potassium is 3.5 to 5 milliequivalents per liter. So hypokalemia, hyponatremia, hypocalcemia, these all hyporeflex, जो मन करे बोलो, सब hypo होगा. मतलब this again remember, hard work and smart work. This is smart work. Like it's HIE hypoxia, so everything will be hypo. Why I am stressing on so much of words? Because it was an MCQ. That can HIE cause hyperglycemia? The answer is no. Can HIE cause hypercalcemia? The answer is no. Everything is down, reflexes are down, all the metabolites, electrolytes, everything will be down. It is as simple as that. अब हर एक वर्ड का पैथोफिजियोलॉजी करने बैठ के तो ये 4 घंटे का एक बहुत लंबा लेक्चर होगा. वो करते करते तुम्हें चक्कर आ गए, तुम गिर जाओगे. सो इट्स बेटर दिस मच ओनली विल कीप इट. नेक्स्ट. Yeah, how, this is a very good question. How do you diagnose HIE? Diagnose कैसे करते हैं? Now, who will tell me how do you diagnose HIE? We are coming to the end of the topic. How do you diagnose HIE? Like, should I get options are, should I get a X-ray done? Should I get ultrasound cranium done? Should I get MRI done? What should I get it done? In these three options, what will you get it done? अंशु पांडे, टेकिकार्डिया. डियर, टेकिकार्डिया हो सकता है, इट्स अ पार्ट ऑफ काइंड ऑफ अ सेप्सिस और हाइपोक्सिया. लेटर रिलेटिव ब्रेडिकार्डिया होगा. ठीक है, टेकिकार्डिया फॉलोड बाय रिलेटिव ब्रेडिकार्डिया. सो द आंसर इज, या, संधु इज राइट. The diagnostic investigation of choice for HIE is MRI. हम हर बच्चे का, every baby in our nursery, in my nursery, like I work in neonatology unit, so every baby's who has not cried immediately after birth, I get a MRI done. I get a MRI done. If a baby is having seizures, if a newborn is having seizures, then the investigation of choice is transcranial ultrasound. Transcranial ultrasonography is the investigation modality of choice or diagnostic investigation of choice for neonatal seizures. But definitely MRI, of course. Yes, that's true. Yeah, Vanilla is very right. You get a ABG for the definition or to define it is HIE, and you get a MRI to diagnose it is HIE. And what will you get in MRI? Same, subcortical damage, brainstem nuclear damage, parasagittal areas, periventricular areas, जो हमने पढ़ा है वहाँ डैमेज नजर आएगा हमारे MRI रिपोर्ट में. Okay, and one of the treatment, yeah, this is a very good one. One of the treatment, now this is star mark again, a NEET PG question. One of the treatment for what you called HIE, baby not cried. One of the treatment of HIE is therapeutic hypothermia. Please, this is the NEET PG question. You need to understand. We intentionally keep the baby hypothermic intentionally. we keep the baby intentionally hypothermic. ठंडा रखते हैं हम बच्चे को. The baby not cried, no, we intentionally keep the baby's temperature between 36 to 34, 33 to 34 degrees Celsius. The normal temperature is 36.5 to 37.5, right? Mild hypothermia is 36 to 36.5, moderate is 32 to 36, and less than 32 is severe hypothermia. So 32 to 36, almost kind of a moderate hypothermia. We intentionally keep the baby, in the moderate or 33 to 34 degrees Celsius. Why? Because I'll tell you why. But first, understand, ये रखते हैं. That is known as therapeutic hypothermia. Now question is when to start. I'll tell you why हम क्यों बच्चे को ठंडा रखते हैं. Why do we keep the baby ठंडा? Just remember one thing. It decreases the apoptosis. And if a one line answer you want to know, why you keep the baby thanda, when you keep the baby a little hypothermic, no, it will decrease the apoptosis. Apoptosis is programmed cell death. So because in hypoxia there is a cell damage happening, no, hypoxia, ischemia, dying, everything is dying, ischemic necrosis is happening. To prevent that, we keep the baby in therapeutic hypothermia. We put the temperature less of that baby, thanda rakhte hain, because it prevents in apoptosis, nothing but programmed cell death. Again, I'll tell you why. Still, there is a reason, I'll tell you. But try to understand whatever I'm trying to tell you first. Okay, so when to start? बच्चे को जो ठंडा रखना है, the therapeutic hypothermia 33 to 34, when to start? Number one, very important, within 4 to 6 hours. I told you, right? There is a window period, 6 to 24. Like, remember I told you there's a primary energy failure and secondary energy failure, and that part is our window period where we can prevent, where we can do a reversible thing. Otherwise, the baby will go into irreversible damage. So within 4 to 6 hours, baby come to me that by a history of baby not crying, meconium tha bachcha, I got a ABG done, severe metabolic acidosis, pH less than 7 and all that. So I will keep the baby within 4 to 6 hours. I have to start therapeutic hypothermia. Until when to continue? Very good. Who has told this answer? Very good. Isha Srivastav, you rock. So till when to continue? Till 72 hours of life. So you start within 4 to 6 hours of life and you go till 72 hours of life. What are you doing here? You're doing therapeutic hypothermia. You're intentionally keeping the baby's temperature less because it will decrease the apoptosis. Programmed cell death will be little slow. Okay. Mechanism, that's what. Now listen to the mechanism. Why we keep bacha thanda? Why are we keeping the baby hypothermic? Why it is helping in the baby metabolism? Because once you keep the baby in therapeutic hypothermia, if you keep the baby intentionally low temperature, so there will be decreased cerebral metabolism. There will be decreased cerebral metabolism and decreased blood flow. Hypothermia, no? In general, remember, you have reduced the speed of the machine. A machine which is working, you have slowed down the machine. Why? बच्चा ठंडा होगा तो मेटाबॉलिज्म भी धीरे होगा, ब्लड फ्लो भी धीरे होगा, मेटाबॉलिज्म भी स्लो हो जाएगा naturally. So when there is hypothermia, remember, there is decreased cerebral metabolism. So there is decreased blood flow, of course, because everything is slowed down, and that decreases the energy requirement of the child, and also cerebral edema. That also decreases the cerebral edema, because so much of hypoxia and ischemia, baby gets a brain damage leading to cerebral edema. So decrease cerebral, yes, exactly, decrease cerebral metabolism and decrease blood flow. That is the first mechanism. Second mechanism is, again, वही सब slow कर दिया ना. एवरीथिंग यू हैव डन स्लो, एवरीथिंग यू हैव डन स्लो. बच्चे को ठंडा करके तुमने हर चीज स्लो कर दी. क्या स्लो कर दिया? सेम, दैट डिक्रीज एनरोबिक मेटाबॉलिज्म, डिक्रीज फ्री रेडिकल प्रोडक्शन, डिक्रीज ब्रेन लैक्टिक एसिड, ग्लूटामेट, नाइट्रिक ऑक्साइड, ऑल दिस फ्री रेडिकल you have done decrease production of all these things, and usually they are very excitotoxic. So there will be less excitotoxic, there will be less injury to the brain. Are you understanding? So you have to channelize your mind. Okay, yes, exactly. So number one, decrease cerebral metabolism, decrease blood flow, decrease free radical production, you can say. And also, yeah, same only, free radical production अगर कम होगा तो apoptosis भी कम होगा और necrosis भी कम होगा. Whenever there is decrease free radical damage or free radical production, there will be decreased apoptosis and there will be decreased necrosis. It is as simple as that. So these all are the mechanisms of therapeutic hypothermia. And what are the examples of free radical? Can anyone give me an examples of free radical? That was another exam question. Isha, Subhashmita. Huh, right. Vanilla is right. Urmila is right. Isha is right. Name some. Could you name me some, what do you call free radical? Give me 4 examples of free radicals. Anyone? Hmm. Yes, Isha is right. Yeah, very good. So the free radical examples are, we have superoxide radical, hydrogen peroxide radical, hydroxyl radical, peroxyl radical. Other than nitric oxide, very good Anshu Pandey. I'm happy, really happy Anshu is trying. So superoxide radicals, hydrogen peroxide radicals, hydroxyl radical, peroxyl radical. These all are free radical generation which causes damage to the brain. So in therapeutic hernia, these all productions of the free radical becomes little slow. So apoptosis slow, necrosis slow, cell death slow, like that. Then over. And the most important contraindication, this is a super speciality question, okay? What is the contraindication of therapeutic hypothermia? Itna sara therapeutic hypothermia we have studied, that you have to start within 6 to 6 hours, you have to go till 72 hours and all that. The absolute contraindication of therapeutic hypothermia is, number one, major congenital malformations. Number one, like the baby did not cry, I understand. Baby is in severe birth asphyxia, I understand. Baby ka apgar is less than 3, I totally get it. But if the child is having major congenital malformations, then you will not do therapeutic hypothermia. Second, suspected chromosomal disorders, trisomy 13, 18, 21, any, yeah, very good, Isha, Shubhangi, Kaushik, very good, Sandhu. So what are the contraindication of therapeutic hypothermia? If there are major congenital problems, please don't start therapeutic hypothermia. If you are suspecting any chromosomal disorders, please don't start therapeutic hypothermia. And if there is anything, active bleeding or shock, this is also important. If the patient is actively bleeding, naturally patient is in shock, patient is in catecholamine resistant shock, or patient is actively bleeding, why do you want to make the baby more hypothermic? That will lead to more damage actually. So these are the important contraindications. Yeah, exactly, Sandhu is very right, है ना? Yes, very good. These are the important contraindications of therapeutic hypothermia. That's it. And in general, yeah, just remember this, read this part. Don't, I will not make you cram this, just in general. What is the selection criteria for therapeutic hypothermia? Usually the babies who are more than 2 kg. The babies who are more than 2 kg and more than 35 week, more than 35 week baby and more than 2 kg baby. Normally these babies we mota we take it because they are kind of, they can like survive all that. And who are less than equal to 6 hours since birth. I told you, right? 4 to 6 hours. 4 to 6 hours you have to start therapeutic hypothermia, not later. So those babies I will start. Any apgar is less than 5. Any naturally any evidence of birth asphyxia, any need for intermittent positive ventilation, like nothing but bag and mask ventilation, any ventilation was required till 5 minutes of life. Same ABG mein pH was less than 7. Are you understanding? There's nothing to cram here. Which babies I will put on hypothermia? Just remember, who are more than 2 kg and who are more than 35 weeker, those babies can go for hypothermia. Who have less than equal to 6 hours since birth, I can start them. Whose apgar was less than 5 at 5 minutes, I can start them. जिनको मुझे bag and mask करना पड़ा for 5 minutes of birth, I can start to them. And again, which is a definition basically, ABG इनमें pH less than 7, that also we can start. Okay, baby on mechanical ventilation like with endotracheal tube, can we start therapeutic hypothermia? Good question, my dear. Yes, we can start, but again, the baby should be kind of little stable. The baby should not have major, like, again, no, if the baby is on mechanical ventilation, dear, if the baby is on mechanical ventilation, Anshu, just imagine or remember that baby will be plus minus will be in shock, or that baby will plus minus will be on inotropes, dopa, dobutamine. Baby is on venti, okay, means baby is very sick. The baby is on ventilator, baby will be very sick. So that baby will be plus minus, definitely will be in some shock position because he's on ventilator, means कुछ तो बहुत बुरा हुआ होगा. So again, if the baby is on shock on inotropes, तो यहाँ पे तो वो contraindication ही है ना. If the baby is on catecholamine resistant shock, if the baby is in shock, then it is a contraindication of therapeutic hypothermia. And indirectly, did you understand? That's it. Over. And the last question: what if the newborn is having seizure? If a newborn is having seizure, if a baby who did not cry and he got a seizure, what is the drug of choice? This is the last question, then the class is over. What is the drug of choice, anyone? Yeah, what is the drug of choice of neonatal seizures? Very good. The answer is phenobarbital. Phenobarbital, phenobarbital. Phenobarbital is the drug of choice of the neonate having seizure because of any reason. That's it. If a newborn is having seizure because of did not cry and this and that, then phenobarbital is the drug of choice. Very good, Mahi. Okay, Mahi has come new over here. Very good. That's it. Thank you so much. Thank you so much for the participation. Thank you so much. And जाने से पहले we have this uh, amazing quote. It says, people who hate me, people who hate me motivate me. People who hate me motivate me. Okay, so most importantly, you don't never ever get discouraged in life. If someone hates you, someone say anything about you, you have your own journey, you have your own path, you have your own cycle. If someone, there's a very nice saying, people who hate me motivate me, like I'm like, now I'll do more nicely, now I'll work hard more nicely, so it's like that. People say कि तेरा तो नहीं होगा, I don't think so you'll get a selection. You'll be like, don't answer back to them, and you'll be like, dude, definitely my selection will happen, you should watch yours. So work hard, work hard, work hard. Okay, that finishes the segment of the topic of HIE. It took around almost 1 hour, and we have a huge crowd still online with us. Thank you so much. And tomorrow we have a class. Tomorrow, which class we have? Tomorrow we have a class on intraventricular hemorrhage. Tomorrow we have a morning 9:30 session on intraventricular hemorrhage on YouTube, and morning 9:30 a.m. If you guys are free, please feel free to attend. And bye bye. Take care. God bless you. Be happy. टेंशन नहीं लेना, खुश रहना है, ठीक है ना? हम में बाकी पानी कम है.